Good afternoon, everyone. Today my talk will be comparison between anatomical outcomes after laser versus injection. Understanding retinopathy of prematurity, what is ROP? ROP is a vasoproliferative disorder of retinal vessels affecting premature newborns. It occurs when abnormal vessels develop in retina. The primary criteria in India is gestational age of 34 weeks or birth weight less than 2,000 grams. A secondary criteria is 34 to 36 week with risk factors, and screening schedule starts at 31st week post conceptional age or 4 weeks after birth, whichever is later. These are the zones. For the localization of vascularization, we divide retina into zones: zone 1, zone 2, and zone 3. And also, depending upon at the junction of vascularized and avascularized area, we divided the ROP into stages. Stage 1 is demarcation line, stage 2 demarcation ridge, stage 3 is extraretinal neovascular proliferation, stage 4 is partial RD, stage 5 is total RD. For indication of laser is type 1 ROP, threshold ROP, and patients whose follow-up is not reliable. And anti-VEGF is contraindicated. And indication for intravitreal injection is type 1 ROP in zone 1 and AROP. AROP doesn't follow the rules of stages of ROP and it shows rapid progression. And when laser is difficult and dangerous, it's also contra or institutional constraints are seen. There is critical need for timely intervention. Mostly, only 5 to 10% babies require treatment. Only by early detection, treatment window. At specific treatment window, it's very crucial to treat such childs to prevent long-term impact. Current approaches are anti-VEGF injections, which we use bevacizumab, ranibizumab, and aflibercept. Aflibercept has been accepted as FDA approved from February 2023. Laser, we use NdYAG double frequency green laser to ablate the avascular area. Study design, we have selected patients who need basically type 1 ROP, which require treatment, and we allocate the patients to the group. We have taken total 40 patients divided into 2 treatment groups, group A, group B, and anatomical outcomes are compared according to that. And these shows the demography. 22 anti-VEGF patient was given and 18 patients were given laser. We have divided the anatomical outcomes into 2 parts, favorable and unfavorable. Favorable includes ROP regression, and unfavorable include retinal hemorrhages, vitreal hemorrhages, retinal detachment, and persistent avascular area. Anti-VEGF is given in group A, which under standardized protocol, and a laser was given with NdYAG double frequency green laser, targeting the avascular area. And anatomical analysis was done when we have seen from 18 patients out of 17 patients out of 18 show regression, and 21 patients out of 22 patients shows regression, showing the favorable outcomes. And immediate treatment response was seen that the eyes treated with anti-VEGF injection demonstrated faster resolution with the plus disease and neovascularization. 95.45% of patients shows regression, and laser treated patient shows gradual but consistent regression of ROP. And regression occurred in intravitreal injection patient compared to that of the patient shows no statistical difference in patients in our study. Supporting evidence from literature, these are the studies we have seen showing the similar results. And study limitation is that the current study limitation is relatively small size of the data, single center study, and follow-up durations are constrained. Lack of the long-term visual assessment is absent. Future research priorities are large-scale multi-center randomized trial, long-term visual and refractive outcomes, cost-effectiveness analysis, and optimal dosing and retreatment protocols. These are few of the cases. Zone 2, stage 2 with pre-plus disease, 7-hour clock of extent of the disease, and after laser, there is somehow resolution of the pre-plus disease, and better regression is also seen. This is stage 2, zone 2, stage 2 with plus disease with a 8-hour clock of extent. This is before and after injection. And also in specifically in laser patient is in patients with zone 1 disease, posterior zone 2 stage 2 with the plus disease 8-hour clock of extent after injections showed quite a good regression. Conclusions, we both intravitreal and NdYAG photocoagulation are equally effective for ROP, each with distinct advantages and limitations. Anti-VEGF injection provide rapid initial regression with fewer procedural complications but higher recurrence risk requiring closer monitoring. Laser photocoagulation, they offer more sustained anatomical outcomes with lower recurrence rate at the cost of peripheral retinal ablations, and treatment selection should be individualized considering the disease severity, anatomical location, and follow-up capabilities. Thank you.